Hello, everyone. Welcome to this Eastern Circle Incorporated, ECI, Health Education Monthly Session. April is the month that focuses on sexually transmitted infections, also called STIs or STDs awareness. This presentation explains what STIs are, how they spread, how to reduce risk, and what to do if exposure occurs. Education and awareness help protect both individual and community health. Presented by Dr. Denise Romney-Adams, DNP, FNP, RN, founder of Eastern Circle Incorporated. You may hear both STI and STD used when discussing sexually transmitted infections. An STI means a person has an infection that may or may not cause symptoms. An STD means the infection has progressed to cause disease or symptoms. Healthcare providers often use STIs because infections may be silent. Many infections remain silent, meaning people may not know they are infected unless they are tested. Let's begin this discussion on what an STD is. STD means sexually transmitted disease. A sexually transmitted disease is an infection that spreads primarily through sexual contact between individuals. Transmission may occur during vaginal, oral, or anal sexual activity, and some infections can spread through skin-to-skin genital contact. Certain infections may also spread through blood exposure, sharing needles, or from a pregnant mother to her baby during pregnancy or childbirth. Understanding how infections spread helps people make safer health decisions. Several types of sexually transmitted infections affect millions of people worldwide. Common sexually transmitted infections examples include chlamydia, gonorrhea, syphilis, human immunodeficiency virus, human papillomavirus, genital herpes, trichomoniasis. Some infections can be cured. Others can be controlled with treatment. Infections such as chlamydia and gonorrhea can often be cured with antibiotics when detected early. Other infections, including HIV, herpes, and human papillomavirus, HPV, cannot currently be cured, but can be managed with medical treatment and ongoing care. In the United States, sexually transmitted infections remain very common. According to the Centers for Disease Control and Prevention, more than 2 million infections, such as chlamydia, gonorrhea, and syphilis, are reported each year. Because many infections do not cause symptoms, regular screening and testing are extremely important. Globally, the burden of sexually transmitted infections is even greater. The World Health Organization estimates that more than 1 million infections occur every day around the world. Each year, approximately 374 million new infections occur from 4 major curable STIs: chlamydia, gonorrhea, syphilis, trichomoniasis. These numbers highlight the importance of education, prevention, and access to healthcare services. How to promote better sexual health. Promoting better sexual health begins with education and awareness. Individuals should feel comfortable discussing sexual health concerns with healthcare providers and partners. Regular medical checkups and recommended vaccinations can also help reduce risk and improve overall health outcomes. There are several important steps people can take to reduce the risk of an infection. Using condoms consistently and correctly during sexual activity significantly lowers the risk of many sexually transmitted infections. Testing before entering new relationships and limiting the number of sexual partners can also reduce exposure. Although many infections cause no symptoms, some warning signs may appear. These may include burning during urination, unusual discharge, sores or blisters, pelvic pain, or rashes. If any symptoms occur, individuals should seek medical evaluation as soon as possible. If someone believes they may have been exposed to an STI, it is important to act quickly. Avoid sexual activity until testing is completed and results are known. Early diagnosis and treatment help prevent complications and protect partners. Treatment depends on the type of infection. Antibiotics often cure bacterial infections. Certain conditions may be effectively managed, though not cured, through ongoing treatment. For example, viral STIs. Sexual health is part of overall health. Testing, prevention, and early treatment help protect individuals and communities. Without treatment for STIs/STDs, it can lead to infertility, pelvic inflammatory disease, PID, chronic pain, pregnancy complications, cancer, HPV-related, and increase HIV risk. Key take-home messages. Protect your health. Get tested regularly. Use condoms. Communicate with partners. Seek medical care early. Follow treatment recommendations. Sexual health is part of overall health. Thank you for participating in the ECI Monthly Health Education Corner. Please like, share, follow. www.easterncircleinc.org. Contact number 1-800-901-5104. Here are references where you can find evidence-based information.